Ready?
Hmm.
Let's go. So, thank you very much for the time. We are here today again, everyone, for another podcast. I think it's a super really cool one if you just think about it. We're just going to talk a little bit about something that we have not talked previously in our podcast, and I'm really looking forward. So, I have Dr. Eric Harris with me today, and he will talk us a lot about what is being doing over the last years. But before I get into that, if you could just give us a bit of introduction who you are and what you have been doing, and then we take it from there.
Sure. My name is Eric Harris. I'm a dentist in Arizona in the United States. And I work currently in education, in academia. I teach at a university called A.T. Still University here in Arizona, and also at a few other postgraduate programs. And I also am one of the co-founders and one of the directors of Bright Island Outreach, which is a nonprofit organization that takes free dental care to people of the rural areas of the Dominican Republic. We've traveled a few other places, but we're primarily focused on work in the Dominican Republic.
Before we get into that, anything else? Why Republic of Dominican, that specific country?
Well, yeah, that's a great question. So I grew up around here, went to dental school in San Francisco, and was in practice for about 7.5, 8 years. And I had a motorcycle accident, and which kind of forced me out of clinical practice. Not something I would have chosen for myself. Crashed going about 80 miles an hour and broke my back in a few places, and both of my hands badly enough that they had to rebuild one of them.
Oh.
And so that was a wake-up call for me. And coming out of that, I was wondering if I was going to be able to get back into practice, because I really loved doing what I was doing. And what I found was an opportunity in education at the dental school. I was offered that opportunity by the dean at the time, and I kind of did it thinking that it would be a good way to get back into practice until I had recovered. And it was so fulfilling and so unexpectedly wonderful for me that I kind of stuck with it and pursued that path and abandoned the idea of going back to clinical practice. And I found a real joy in teaching there. And as I was recovering physically from that accident, one of my friends and mentors, a doctor in Utah named Roy Hammond, who had been setting up and conducting these trips to the Dominican Republic, invited me on one of them. And I went with him as a volunteer and met amazing people there who have since become my family. And among them was Dr. Jonathan Diaz, who is a dentist, young dentist, and educator there in the Dominican Republic. And he and I became fast friends and had the idea of getting my students and his students together to do something. And so that's where it began. In terms of why the Dominican Republic, I mean, what you'll find in my story, quite like stumbling upon teaching and humanitarian work, is that it happened by accident. I mean, quite literally in some cases. But, you know, it really wasn't a plan where I thought I want to help somewhere in the world and I'm going to select a country. I happened to go down there with a mentor and friend and met people that I knew I'd like to work with and see again. And as we started doing that, what became apparent to me in hindsight was, man, the reason that it's so difficult to do this other places is that connection with somebody in country that has a philosophical alignment with you, that cares about the same things, that you get along with well, because these things are challenging to do. And if you don't love the person you're working with and the people you're doing it for, it gets old really fast. And so it's been the opposite of that for me, though. It's been fulfilling in every category. And so we kind of got the cart before the horse, as they say. as we started this, we wanted to do it to get together and to help other students have this educational experience and this cultural experience. And it kind of progressed from there. But that's what I would say is the reason that we've stayed there and focused our efforts there is we have a phenomenal relationship with the government there, the universities, the medical and dental schools, and local dentists and physicians. We can put out a few phone calls and count on as many Dominican dentists and physicians as we need in any given expedition that we do, and that's something that's really, really difficult to arrange for any other place.
What I really like on your thing is in your project, on your foundation, not necessarily just one time, is you combine multiple things, right? First, you combine dental hygiene and care, which I will ask you a lot of questions because I'm afraid of dentists. So
no, that's okay.
I really like panic on dentists. But then you also combine education, right? And that is what I find really interesting, because it's not uncommon that people does volunteering or create foundations and go out there and do something. But what you are bringing is the students that are, and I always talk about education, that they are creating their career, creating their getting the knowledge, but they also creating a lot of their values, right? Or at least getting them even stronger. And doing these type of things brings them this experience of getting to know conditions and areas that have a lot less than what we have in, not just in Netherlands, but of course in the US as well. What kind of feeling and things you get from the students? And I really have no idea, so I'm really interested in that.
Well, that has been the real driver behind everything. I mean, I'll never get tired of of helping people who otherwise wouldn't be able to get care, but it is the joy and the fulfillment are magnified when you get to experience seeing somebody else experience that for the first time or contribute to that. And so, as an educator myself, I really enjoy teaching students. And when it's here, it's a lot about ways to connect and help connect with and help their patients, or the clinical aspects of what they're doing. But working with students it's what makes this so great. Part of that is that they're so enthusiastic about what they're doing. They're just learning to do this, or not just learning, but in the early stages of practicing this. And so, if you ask a dentist who's been in practice for 30 years if they want to extract a tooth on a child, they're probably not going to want to jump up right away and do that. The dental students are much more likely to be excited about the opportunity to serve, excited about the opportunity to do something that they've spent the last X number of years of their life learning to do, because it could help people. Now they're having the opportunity to put that into practice. And that is a remarkable, probably the part of this that's the most fulfilling for me. It's challenging in some aspects, and I found what's really important with these environments, especially with students, is there are a couple things that can increase the depth of the experience and the value of the experience for them. One is, just as you mentioned, being in an area where they get to see what people live like who can't afford to go to the dentist, or much less a toothbrush, who have these challenges and decisions like, am I going to wear pants or a shirt today when I'm a little kid? Because I've got one pair and one's getting washed. And these are things we see. And so it's humbling for everybody. And that's an experience that when you're there kind of in solidarity with other people with the same idea in mind, wanting to help these people, it just compounds the emotion of it all. The challenges, I would say, we're dealing with students who are in their 20s and 30s, sometimes early 30s, and when they go to the Caribbean, they like to have fun. And so we try and pack as much into that as we can, in the way of, hike out to this waterfall or tours to these places or things like that. And with that, the reason I say that's a challenge, it's not really a challenge, but the reason I say that is a challenge is because there's this perception of voluntourism, right? That becomes a trap. And I laugh a little bit because on our expeditions, we start with a day of fun and end with a day of fun, and the stuff in the middle is really challenging. So they get out there, and after the first day, they're like, okay, I see what this kind of trip is. But after day two, they repent. They're aware of the fact that they're going to be working really hard. But it's great to have some time at the beginning to get everybody to get to know each other, some time at the end to kind of relax and celebrate what was done. And that challenge, as far as I'm concerned, the voluntourism challenge, we can focus on doing everything we can to magnify the impact that we're having on that community. And if doing these fun things is part of that, that's not a problem for me, because I see these students go down there, and whether they're down there to do the hike to the waterfall or the boat ride out to the island or things like that or not, they leave transformed in almost every circumstance. So that's a trapping of working with students in an educational setting, but these are small problems, right? I mean, having a group of people there that is enthusiastically prepared to just work and do it and lay everything on the line, I really love it. Love working with them.
So let's focus a bit on the dental care. So in a lot of countries, including Portugal, dental care is it's a big problem. I think a lot of probably other countries where we have economical issues, where the social system is not exactly very developed, there is still a lot of awareness, lack, or information about the problems that you can have health-wise if you don't take care of your hygiene and stuff like that. And I'm talking on myself. So I came from Portugal, where the dental care was not really nice. I came from a very low-income family. I managed to get a public dentist that was just a nightmare, and I ended up losing 13 teeth. So it's one theory. So I'm talking just personal experience, right? It's not just making it up. And I don't have any problem to talk about it. It's just perfectly fine. How is this, and I can imagine in your outreaches, but also in the United States, how is this being handled? Is this something that is ever going to get better? Are we doing enough to get it better? Because the health impacts, and you probably could help us a little bit to understand, are huge, even though people don't understand.
Yeah. Man, what a great question. And it's meaningful that you have a personal sense of the stakes involved here. I mean, we both neither of us grew up in a third world country, right? And so we have the benefits of that. And I get questions all the time. There's a lot of people in the United States that need help. Why don't you go help them instead of going to this island? And my response is that I do. That's what I do in my day job when I'm not on the island. But I think that that's true of most dentists as well. Even the ones that are in fee-for-service, for-profit situations. I don't really know any dentists who don't do some amount of pro bono work, and some of them a significant amount, and many of them, devote themselves entirely to public health dentistry and helping people who are underserved. And you look at the problem in the United States, where it is the primary reason that kids miss school. It's the primary reason that adults miss work. It's the most prevalent disease among the 260 that are studied for global impact. Mm-hmm. It's linked to and associated with heart disease, diabetes, and a number of other things. There's recent research that points to being linked to Alzheimer's and dementia. So these are all, and this makes sense, right? Your mouth is part of your body, and it's a critical part of it. But I think that in first world situations, part of the problem is that one of the problems is that dentistry has kind of distanced itself from the rest of medicine. It's not perceived to be, a part of medicine in some circumstances, but the same way that other things are.
Correct.
And I think that there are a number of, that gets complex, but I think there are a number of things to point to as a cause for that. But I mean, in every country, and certainly it's much, much worse in the third world, but in every country, the problems are really the same. The risk factors for disease are oral hygiene, right? And also food consumption, carbohydrate consumption specifically. And there are other things too, some genetic factors and things like that, but by and large, there are those two things. And the reason they're challenging is because there's no amount of intervention that is going to make up for a heavy sugar-based diet and a lack of education or understanding about the importance of oral health care, because it takes diligence, it takes compliance. People have to brush their teeth. And it's also really easy to say, well, if they've got bad teeth, it's because they didn't brush them, right?
But it's not. Let me
Because
just
it's a
interrupt you.
preventable disease, we often put that on people.
Yeah, but let me just, sorry to interrupt you, but it's very important what you just said, because I used to brush my teeth all the time.
Yeah.
And I lost a lot of, and even that after that, I kept having caries, right? Or I think is the right word.
Yeah.
And I kept on asking dentists, but why the hell I keep on having these problems? I do it 3 times a day. I don't, it's not that I don't care about it. And so one day, one of the doctors said, after a few others just keep on fixing the fillings. One guy, a dentist said, let's do a test. This, this violet thing that you put it and you just brush and see where you're doing it.
Yeah.
He said, well, that's your problem. You are just brushing it on the bottom part, and you are not going to the gingiva, and that's what is causing all this to happen. You are getting the problems on the top and bottom part because you are brushing it on the same place, but rather on the right direction. It was such a simple advice that I used to bleed when I was brushing my teeth, and I never did it anymore. I just got.
Well, that's exactly the point I was about to make. It's that's it. It's so easy to blame people or to look at that problem as, well, they just don't brush their teeth. What do they expect? But it's as simple as that. Many, many people in the world never receive that little bit of education that you just did. And there's so many other things that are helpful to teach, but if they don't have the opportunity to sit down with a healthcare professional who's willing to take the time to do that, that isn't something that they're just naturally going to learn to do. And there are other factors. I see patients who rarely brush their teeth at all and hardly have any decay.
Yes.
And other patients who are meticulous and constantly get decay. There are factors that are related to medications and dry mouth or xerostomia, all these things. But fundamentally, if we're looking at the 2 reasons for, tooth decay and problems being sugar and oral hygiene, if we look at those 2 and split them up, there are 3 things. There's cost. Now, oral hygiene, you wouldn't think that that'd be a very expensive thing to do, but it's not just brushing your teeth. And let's forget for a moment that many, many people in the world cannot even afford a toothbrush and toothpaste. But I've been with the Maasai tribe down in Africa and Tanzania, and had them show me how they make their toothbrush every day out of an acacia tree stick. And it's fascinating to me that different cultures have come up with these things, but it's not always a priority. And when people are making $1 a day, a $2 tube of toothpaste is an expensive thing. So, and there's a generational thing too, right? We learn these things primarily from our parents, but there are wonderful parents out there who will never sit down and put a disclosing tablet in their child's mouth and to show them where the plaque's building up. It's just not something we have to deal with. But there's cost, and there's education and understanding. There's your dental IQ, and that's not something that's innate like an IQ. It's something that has to be learned. You have to learn how to brush properly and how to take care of your teeth, and the importance of doing that. And we need to get past this judgment of those who have not learned to do that or have had other circumstances. And then the other part of it is changing the diet of a community. And that is so challenging, especially in areas that are socioeconomically on the lower end of the scale. In the United States, they call areas like this food deserts, where it's impossible to get healthy fruits and vegetables and food. that isn't going to contribute to tooth decay and obesity and these other things. In the third world, the challenges that we face, for example, are the Dominican Republic, their primary crop, their primary source of income for the country is sugarcane and rum.
Yeah.
So you have these children walking around, their parents making $1 or $2 a day in some circumstances. Coca-Cola is much cheaper than clean bottled water there. And they've got sugar literally growing all around them that they can just pull off and chew on. And you'll walk the streets and see chunks of sugar cane with little kids' teeth marks in them all over the place in that country. So these are challenges that are more than just, a simple solution to resolve.
Now just listen to you. I see two things happening that somehow happen to be connected, and you can correct me, from a medicine perspective, those are two areas that are very often kind of, that's a different thing, like psychiatry and dental, what do you call it? Dental medicine. Because both are kind of, this is just a different thing. They're not really doctors. They're just trying to fix people. They're just giving meds for people that is depressed, and the same with the dentist, right? It's not really a doctor. It's just a dentist. But the interesting thing is, I think there's a lot of people that is getting all over the world, for example, problems with their tooth decay, and probably those are the ones that even breast a lot, and they start having a lot of psychological problems because first they don't know the reason. Second, they feel ashamed to go to the dentist, and just thinking now, this is like almost a snowball effect, right?
Absolutely. Yeah. So what we talk a lot about in dental school as we're educating students is the oral systemic connection, right? That it's not, these aren't just teeth, they're not just mouths, they're people, and the link between tooth decay and some systemic diseases is very strong. Yeah. But aside from that, there is, I would call it the oral systemic social connection, because you have to think about the impact these things have. I work a lot with the homeless population of U.S. veteran soldiers here. Mm-hmm. And we see a number of these, and this is one population, but there are many like this. People who are experiencing trauma in one form or another, post-traumatic stress, a lot of these things that show up. And so they're put on medications for this, which cause dry mouth, which cause their teeth to rot very quickly. Yeah. And suddenly they find themselves in their mid-30s with no teeth. And the impact on them socially, the impact on their psychology, the impact on their ability to get a job, to be able to contribute to society, but also I mean, the difficulty is which fast food restaurant is willing to hire somebody to work the cash register that doesn't have any teeth?
Of course.
And dentures are thousands of dollars. Mm-hmm. So, and one of my mentors, my dean, my former dean, commented to me one time. He said, "How much do you think we could lower the unemployment rate if the government just said, we'll pay for dentures for anybody that needs them?"
Yes, exactly.
And that if you go down that rabbit hole, it's really astounding. What's even more astounding is how much could we lower that unemployment rate if the government helped pay for more preventive services or educational services. And that's
from the base, right? From the base.
Foundationally, this is how we change that, right? It's not going to happen in this generation, but it has to. We have to get away from intervention and into prevention. And our system of healthcare generally needs to start diverting resources to that. It's not a very popular thing because a lot of healthcare practitioners like the intervention. It's what pays the bills. Yes. But I think at their hearts, most of them would tell you that that's the solution, and that's where they would like to see things go.
But you said it right. A lot of the governments, and I think maybe could be also because a lot of them that are the lawmakers and stuff like that, they don't necessarily also understand the impact. I will just give an example with myself. I used to play football at a fairly high level. and I used to have a lot of how do you call it, muscle related injuries,
Mm-hmm.
and they were. I can't prove scientifically, but since I made the treatment, I never got it anymore. They were absolutely linked to my mouth issues, teeth issues, tooth issues, teeth issues. Um,
Sure.
yeah, and it's crazy because I don't think a lot of our governments really understand it, because in a lot of countries, including Portugal, I can't really say it now, but there is no minimum checkup for 5 years old children or 6 years
Yeah.
old children or whatever. We still have, for example, I don't know if you probably have in the US, this culture of, for example, if you have a 5 years old or a 4 years old a kid that has this, how do you call it, milk teeth, um,
Uh-huh.
and if
Sure.
they get TK, people don't care about it. They say, it's going to fall. It's no problem. It's not, they will come out. And that's just completely wrong.
Yeah, you're absolutely right. Let me give you a story to illustrate this. One of my good friends, who's also a dentist, lives here near me. His name's Dr. Sullivan, Sheldon Sullivan. He has, he's an expert in a lot of things related to dentistry, but I was with him one time and he was telling me about, he was sitting with a woman and her son who was in his preteens. He's 12 or 11, something like that. And she kind of looked at him and said, wow, he's a handful. He's a lot to deal with. And Dr. Sullivan looked at her and he said, and looked at the child and he said, let me guess. He wets the bed frequently. He has trouble sleeping. He wakes up frequently in the middle of the night with nightmares. His grades are slipping lately. He has trouble focusing in school. He's getting into trouble more often. And she said, how did you know that? And he said, he can't breathe at night. I can tell looking at him that he can't breathe at night. And that's one, it seems like a simple thing, right? But if you look at the etiology, it is a very prominent, prevalent issue that a lot of people don't pay attention to. And if you look at what developed that, as a child, if they have a thumb sucking habit or a tongue thrust habit, or if they have decay in their mouth that's untreated and it's causing them pain or infection, and they're waking up frequently during the middle of the night, or it's causing them to open their mouth and they're sleeping with their mouth open while they're breathing, causes inflammation in the tonsils, and which is even more exacerbated by the bacteria and the decay that's present in the teeth. And those tonsils inflamed and they can't breathe at night. And if that goes on for long enough, it affects every aspect of their cognition, development, everything. These things are so linked and so critically linked that, a friend and an expert like my friend, Dr. Sullivan, can look at somebody and say, I can tell how this kid's doing socially and how he sleeps at night by how his face looks.
Yeah.
And so there are these critical links. And one of the things that's amazing about doing this stuff in the Dominican Republic is, we talked about working with students. The other parts of it that we try to involve are international, first of all, because there's a different type and a level of education in each country. And it's great to see professionals from different countries working together. My dental students ask me all the time, what can I teach the dental students there? And I just laugh at them, because the clinical education they get, the clinical experience they get is 10 times what the dental students in the US get. Yeah. They just do a lot more work there. So there's that part of it. They learn so well from each other, but also interprofessional, having physicians working alongside dentists and talking about the ramifications of, well, what's the risk of doing this procedure if this blood pressure is this high? And working in that manner is the way that we kind of resolve what you're talking about, the way that we get a more holistic approach to care, where dentists are talking to cardiologists more frequently and cardiologists are consulting dentists. And that's the way things should be, right? Instead, we sometimes silo things, become so highly specialized that, now there's not only a rhinologist or kidney doctor, but there's one for the left and one for the right. It gets so siloed that there needs to be more communication in order for the patient to understand that this is all connected and all part of the same system.
Um, what about the, so you go to Dominican Republic, and you, there is a lot of, as you said, they have a, it's a very complicated environment. And I've seen some of your videos, and I see when I compare to a place or a medical center here in The Hague, uh, it's not the same, right? So the conditions are not exactly the same. Um, but also, what is the reaction of the people out there? So how much do you think they realize what is being done? It is not just extracting a tooth. There is a lot more that can change their life by taking care of that. What is your experience with that?
You know, you get a range of emotion, and that's a fascinating question, because generally speaking, the people are very excited we're there and very grateful. Now, in the moment, that may not be the case. They're sitting waiting for a long period of time, you know, at the beginning of the day. We're sometimes outside, you know, under tents, and they're going through something that, you know, they might be in pain going into this experience. They're definitely going to have some anxiety or fear around having something done, no matter what it is. Many of them forget to eat, or they don't eat, and because of the heat and humidity can pass out. That's happened before. But generally speaking, they're grateful. They really are. You also get, and you just have to understand what they must be going through sitting in that chair. Some of them seem very stoic and quiet, reserved, and you just have to remind yourself and imagine what they must be thinking going through. Some of them have never seen a dentist in their life. So you get a broad spectrum. I've learned that working with, for example, the Haitian population in the Dominican Republic, they seem to be even more stoic and closed off and unexpressive. And I don't know specifically why that is, but I have to imagine it's because in that country, there are, you know, issues with their neighbors, just like in many other places in the world. And so, you know, in the same ways that we have problems here in the United States with the Latino population feeling that they are accepted and welcomed and loved, Haitians have similar issues there, and some for good reason. And so you'll see a lot more of that stoicism and kind of closed offness, but we don't get people that are angry with us, anything like that. It's always a remarkable experience. But if you're down there for the first time, that's the comment we get the most is, this kid seems to not experience pain because he's not flinching and he's not responding or smiling. He just kind of yes and no. And you have to explain to him, you're an alien to him. You know, this is their first experience with something like this. So it's hard to gauge that based on what they're expressing in the moment, but we generally have felt an overflowing amount of love and support from them. And we stay in contact with many of the patients that we treat.
Look, I think because it's a topic that I goes straight to my heart. I could talk for quite a long time, but I think I would like to keep it in the time that people get excited to listen, because there is a lot of good content in here, and I've tried to make it as personal as possible. If you are to close this and leave a message for people to remember this conversation, I think everything we talked is something we should all remember, because it's not just awareness, it's education. But if you are to leave a message for people, what would you say in two statements, in two sentences, sorry?
Well, first of all, I would tell people to trust. I would tell them to know that in any circumstance, no matter where they find themselves, that it's where they're supposed to be, where they should be, and the secret is to learn what they need to in that moment. And I've been in a lot of circumstances where that was the case. And the second thing I would tell them is that the quickest way to learn what they need to is to find a way to serve and love somebody else. And the minute that they can do that, I think they'll find themselves on the path without having to think about it too much. So if you're lost, go that direction. and that's, you'll find your way eventually. Opportunities will present themselves. That was more than 2 sentences. Sorry, I'm not good at following directions.
Okay, I will shut it. Look, really, thank you for that. I think it's the first time I talk. I wouldn't say the first time. I think I would also like to bring that in. I had a dentist that he moved to the academia world because I think it was the right thing for him to do. It was the first dentist I had in a long time that was explaining me every step on the way what he was doing. And I used to panic a lot on dentists. I used really to get like anxiety and get like super nervous. Like
Yeah.
people he described don't even know how to react. And himself was probably one of the first persons that explained me that there is nothing wrong. It's just going to be fine. And I will explain you every single thing I'm doing when you hear these noises and stuff like that. And having this conversation with you remind me a bit of that dentist that is now teaching others how to probably be like that. So I'm really, really enjoyed it. And thank you very much for taking the time to talk to me, because it's...
You're welcome. I'd love to talk to you again sometime. Love to have you down to the Dominican Republic sometime too. It'd be great.
Well, I think that's probably something that's going to happen, because I think it's... I for sure understand what those people are going through in terms of pain and fear and I don't know, some things.
Yeah, absolutely. It's prevalent.
Thank you.
Hey, I really enjoy and appreciate what you're doing. I feel honored to be a part of it. So thank you for inviting us.